Assalamu alaikum and welcome to another exciting and educating edition of the Health and Fitness Show. I'm Fahad Matin, your host for today, and I hope and pray that all of us are fit and healthy by the grace of Almighty Allah. I pray we all had a nice and positive week so far and looking forward for a nice and chillaxing weekend. This program is broadcasting live today on 28th of November 2024. The time just past 6 p.m. And we are casting our positive vibes to all our lovely people in Luton and all the surrounding areas of Luton like Dunstable, Harpeth and Bedford. Our positive airways reaching out to all our listeners through Inspire FM radio app, website, and you can view us through Facebook Live link and YouTube live channels. If you're listening to the show on Sunday or any other Thursday, that means it's repeat. But today we are doing live on 28th of November 2024. As we all know, we do different topics every single week and we cover different informations about our health, about our well-being. And today's topic is to do with our women's, our sisters' health and how they can look after their well-being. Especially bones. So in terms of people who normally know us, you know that we do different health related topics, and today's topic is slightly different in a sense because one of the things which majority of the people are affected with is bone health, and in female it is even more higher, and that's why they sometimes had a condition called osteoporosis. So yes, today we will be talking about osteoporosis. Yes, you have heard me correctly. And luckily, I'm not the person who will be talking on this topic. I have two lovely guests joining me. One of them is in the studios and one of them will be joining me online through our online link. So joining me today in the studio is none other than Maddy, and she is from Royal Osteoporosis Society. Let me welcome her. Good evening, Maddy.
Good evening, Fahad. Thanks so much for having us on the show.
You are most welcome. How are you today?
Very well, thank you. How are you?
Yeah, not too bad. And also joining us in the or through our online link in a few minutes will be Janet Boyd. She will be joining us as well, and she is also a patient representative and a volunteer from Osteoporosis Society. First of all, let's go to Maddy. Maddy, can you give a quick introduction about yourself? Sorry, I forgot your last name.
No worries. My last name is Gamble, Maddy Gamble.
And tell us about yourself and your experience in the line of osteoporosis.
So my role here in Luton is I am the coordinator for our project that we have here, our community project called Better Bones Luton, and I am the community project coordinator. So my job is about getting out into the community, particularly at grassroots level, to spread awareness about osteoporosis, to go to different community groups, different community events, to talk about osteoporosis. Now, I'm not a clinician. My background isn't clinical, but what the Royal Osteoporosis does as a charity, which I'm very passionate about, and I'd like to let as many people in Luton know about, is that we have lots of fantastic resources available that anybody can access. So on our website, of course, there's an absolute wealth of brilliant clinical information, but we also have a fantastic hotline that anybody can call if they've got any concerns about osteoporosis or their bone health. You don't have to have had a diagnosis. Just if it's something that concerns you, something that you have questions about, you can call that and actually speak to a specialist nurse. And then also today, I hope I can speak to you a bit about our risk checker, which is a fabulous resource online that, again, anybody can use. Just runs you through a simple series of questions and lets you know a bit more about your risk of developing osteoporosis. But we'll discuss that later.
Definitely, and hopefully Janet will be joining us shortly as well. I think so. There's some kind of a problem with the link which we are sending it to her. Anyhow, so let's start with you, Maddy. What is osteoporosis?
So, as I said earlier, my background isn't clinical, so I'll just give you a brief definition that we put out on sort of our materials. So basically, osteoporosis causes bones to lose strength and break more easily. Breaks are also known as fractures, even after a minor bump or fall, say like a fall from standing height.
Right. Okay. So that means it's very fragile. The bones become very fragile.
Yes. So they break more easily.
Okay. And I know the project you are running in Luton, you mentioned it's called Better Bones Luton project. So tell me more about this project. What is this project?
Of course, so the Better Bones Luton project is a project by the Royal Osteoporosis Society. And who we are is we're the UK's largest national charity dedicated to improving bone health and beating osteoporosis. And we're here for everyone. We equip people with practical information and support to take action on bone health, on their bone health. And we work with healthcare professionals and policymakers. We're influencing and shaping policy and practice at every level. We're driving the research and development of new treatments to beat osteoporosis together. So the Better Bones Luton project is just for Luton. And it's to support the health and well-being of people in Luton by introducing them to the Royal Osteoporosis Society services, such as our risk checker that I mentioned earlier, to receive an earlier diagnosis, preventing further bone breaks and reducing hip fractures. Our specialist nurse helpline to ensure that people are getting the support that they need. And then also to help establish ongoing volunteer-led support based in the community, because there wasn't any of that happening beforehand.
Wow. Okay. So in terms of when we talk about this whole osteoporosis, why the Royal Osteoporosis Society running project in Luton?
Thank you. That's a really good question. So Luton, has a population of approximately 225,300. Wow. And has been identified by the Royal Osteoporosis Society as a regional, what we call cold spot for us in the detection, treatment and availability of ongoing support for people with osteoporosis. And there's three main reasons for this, we feel. So first of all, there's no fracture liaison service, or FLS for short, at the Luton and Dunstable Hospital. So in other places where there is an FLS, if somebody has a fracture or a break, they're automatically put through a series of tests, which may then let them have the diagnosis for osteoporosis at the end. And there isn't, although the scanners and such like are available at the Luton and Dunstable Hospital, there isn't an actual fracture liaison service there.
Okay, I think so. Janet may be able to join us through our phone link. Unfortunately, for some reason, online link is not working. So it's good she joined us through phone link. So let me introduce Janet as well. Hi, Janet. Can you hear us?
Yes, I can. Can you hear me?
Yes, Janet.
Hi, Janet.
Welcome to the Health and Fitness Show, Janet. There was a problem going through your email. It's bouncing back the links. But anyhow, firstly, welcome to Health and Fitness Show, Janet. And can you give a quick introduction about yourself, please?
Yes, of course. Well, thank you very much for inviting me onto the show. So, yes, my name's Janet Boyd, and I live about 200 miles north of Luton. You can probably tell that from my accent. So I live in North East England, a long way from you. My background is in education. I was a primary school teacher for about 33 years, from which I took early retirement in 2021. And since then, I've been a volunteer and a member of the Royal Osteoporosis Society. So my main role is I'm a community presenter. So I present to a range of community groups, and my passion is to raise awareness of good bone health and encourage people to take positive steps to help prevent fractures in later life.
Yes, definitely, and it is very, very unique. So I believe you have gone through yourself in this about osteoporosis, isn't it? And how was your journey into this one when you diagnosed?
It was a fairly straightforward process for myself. I mean, would you like me to go into more detail?
Yes,
now?
please.
Yeah, okay. Yeah, so I was diagnosed around 5 years ago, and I had a very limited knowledge of osteoporosis. I just thought it was something that older people got. I never thought for a minute that I would have it. I was in my early 50s, and I happened to read a newspaper article that mentioned that if you would be at risk of osteoporosis if you had a parent who had broken a hip. Now, for me, unfortunately, both my parents, both my mum and my dad, both broke their hips in their 80s. And I know what sort of devastating effect that can have on somebody's life, which I'm sure a lot of your listeners may be aware if they've experienced that. I've had a family member who's had that. My dad had other health conditions. He had Parkinson's and some other things, but he unfortunately died as a result of the surgery to repair the hip. My mum never regained full mobility after she'd broken her hip, so she had to have high levels of care for the remaining 4 years of her life. So what I decided to do was to mention it the next time I was at a GP appointment. I didn't for a minute think she would do anything about it, but I mentioned the fact about my parents. She asked me a few just general health questions, and then she told me she would put through a referral for me for something called a DEXA scan, which is it's the way that osteoporosis can be diagnosed. It's a scan that measures your bone density. It's a very simple scan. I've had two in the last 5 years. It's just, if you just lie on a bed, you can remain fully clothed, which is great. You've just got to make sure that you don't wear any metal, any zips. And you can also take a chaperone, although when the actual scan is taking place, there can't be anybody else in the room. But apart from that, you can take somebody with you. So I went for the scan, and then the GP called me with the results a few weeks later. And I didn't for one minute think I would have osteoporosis. I was a very busy primary school teacher, on my feet all the time. I'm sure many of your listeners will know that if they've got children themselves, what hard work children are. And it's a very, very busy job. But I distinctly remember when the GP phoned me, it was a half-term holiday from work, and I was cleaning the bathroom of all things. And the phone went, spoke to the GP, and she said, "Oh, yes, Janet, yes, you've got osteoporosis." And I don't think I even heard what else she said. I just couldn't believe it, because I'd always tried to keep fit. I thought it was something old people got. I'd eaten a reasonable diet. I just couldn't believe it. I felt really alone, very isolated. I didn't know anybody else my age, in my early 50s, with the condition. And I almost felt embarrassed, really, because I didn't want to go into work and tell people that I got this diagnosis of this thing that I thought only affected older people. So what I did was, thankfully, my GP mentioned the charity, the Royal Osteoporosis Society, and she said, have a look on their website, which I did. And I got the number of the nurse helpline, which is absolutely fantastic. So I spoke to a nurse there who was just brilliant. She was so supportive, so helpful and reassuring, made me feel so much better in myself. And after that, I decided that I would obviously make a few lifestyle or improve my lifestyle, I guess. I felt in a way it was almost like a golden ticket, I suppose, because I could have, if I'd never gone to a GP, I never would have had that scan. I never would have had the diagnosis, and I've had no idea. So since then, I increase the amount of exercise that I do, and by that I do go to the gym, and I don't go to the gym to do weights. I tend to do things like Zumba, dance, things that I enjoy, because I think that's the important thing. You've got to find some form of exercise that you like doing, but preferably something that's weight bearing, because that's important to help build your bones.
Indeed.
I try and go. Absolutely. And I try, and thankfully, since I was very fortunate to take early retirement, I'm able to go for walks, which is free, which is great. So I go for walks every day, just in the local area. I live in quite a large town, so it's not like I live in a rural area. So I'm out there walking around the shops, or just walking around the streets. I also make sure that I have lots of calcium in my diet and vitamin D. And I had a scan fairly recently, and my bone density has remained quite stable, which is brilliant. It hasn't declined, a great deal. So without that initial GP appointment, and I think without that phone call to the charity, I think things would have been completely different. It was really hard receiving the diagnosis, but the big thing I would say is that at least I know. So then I can do something about it, and I can help hopefully to ensure that that it doesn't get a lot worse, certainly in the near future.
Definitely.
I am quite, one of the risk factors is having quite low body weight, and I am quite small framed. I'm quite slim, and that's me naturally. I always am. So it's really important for me with the diet to make sure that I do eat properly, because I don't want to lose any more weight.
Definitely.
And of course, in the summer, although I know it can be difficult, just trying to make sure that I do get out when the sun does shine, out for a little bit of fresh air, because I think that's important too. So yeah, my biggest advice to anybody would be, if possible, if you think that you are at risk at all, do your best to try and see. I know it's difficult nowadays, but try and get that GP appointment, speak to somebody, a medical professional, and try and at least get a scan, because at least then one way or the other, and then you can possibly do something about it.
Perfect. Janet, stay online, because we will come back to you about a bit more in terms of other than your experience, how you help other people, and if anybody else wanted to take your route, that will how they can try those. Definitely we will go into those ones. Coming back on the Royal Osteoporosis Society as well, I remember you mentioned about the risk checker. What is Royal Osteoporosis risk checker, and who is it for, Maddy?
So while osteoporosis disproportionately affects women, you mentioned at the beginning that this was particularly an issue for women to think about. It can affect anyone. So the risk checker is an online tool to help people consider their bone health risk of osteoporosis. And the short survey will tell people if they have key risk factors for osteoporosis, and then provide a personalised report so they can take action to protect their bone health if needed, and use this report to start a conversation with their GP. So far, since the risk checker was launched, over 430,000 people have used our osteoporosis risk checker, which has led to over 53,000 estimated early diagnoses.
So is this risk checker is available for anyone to do a self-assessment risk checking?
Yes.
Or is it something which need to be guided by a professional help like a GP or a nurse?
So the risk checker was developed by our clinical team, and anybody can use it to assess themselves. So it's been designed for people who don't currently know they have the condition. So if you haven't already received a diagnosis, to help them consider their risk factors.
So on that note, let me introduce our listeners as well. So listeners, if you have any questions or queries regarding our show tonight, which is osteoporosis, please give us a call on 01582 481822. I repeat, 01582 481822. Or you can send your questions via text messages or WhatsApp on 0779 481822. I repeat, 0779 481822. So in terms of the risk checker, how can someone do that risk check and risk checker the risk check and the risk factors? Can anybody able to go there and do it by themselves?
Yeah, so anyone can do it. So you can find our risk checker by visiting the website or typing in the ROS, that's ros.org.uk/risk, RASK dash checker, CHECKER. Sorry, I forgot to spell there. It takes around 3 minutes and will ask you a series of simple questions about your general health, lifestyle, and family history, and then generate the risk at the end. I have a QR code that perhaps I could share with you and you can put up on your website as well. And anybody can just go scan it from their phone on the screen take you straight through to the risk checker.
So let me go to Janet, because she has gone and seen through the patient's way. So Janet, do you know about the risk checker when you've been guided towards the website, and how did you find it a bit more?
Yes, obviously it wasn't around when I got my diagnosis, because if it had been, it would have been a fantastic thing to have looked at. But I've certainly referred lots of other people to it in one of my volunteer roles as a presenter. I present to a variety of different community groups, and it's great because it's so easy to do, and that's what everybody tells me when I've tried it myself, and it's only a couple of minutes. It's really, really quick, and then you get exactly as Maddy explained, really, what happens next. But yeah, everybody's been very positive about it who has used it that I know of.
So in terms of the risk checker, as you both have seen the risk checker work, what should someone do if the risk checker says you have some kind of a risk factor or any problem whatsoever? So what is the next best step? So I'd like you to both answer from your own perspective. So let's start with Maddy first, and then I'll come to you, Janet. Maddy.
Okay, thank you. So the answers a person provides will determine their personalised results and recommendations just for them. So obviously it will vary from person to person, low risk to high risk. But more generally, bone health is important throughout life. So everybody who uses the risk checker will be encouraged to consider making positive lifestyle choices. So including eating a balanced diet with calcium. I think Janet mentioned that earlier. Taking vitamin D as recommended, and exercising regularly to help keep their bones strong and healthy. And in addition to this, a person with key risk factors may be advised to make an appointment with their GP to start a conversation about their bone health. And this is because our osteoporosis risk checker is not a diagnostic tool. It's only a healthcare professional obviously can give the diagnosis of osteoporosis and predict your risk of breaking a bone. But this is really helpful in letting you know whether or not you should be starting that conversation with your GP. So the risk checker is also intended to raise awareness of factors that are known to increase the risk of developing osteoporosis and broken bones. So as you go through those questions, it will let you know a bit more about the different factors and how that impacts your bone strength for your life. And the information provided is obviously a guide and not a replacement for medical advice. So we'd always encourage people to talk to a healthcare professional as well as using a risk checker. But it's a fantastic first step for anybody that's not too sure where they stand.
And Janet, from your perspective, what do you see, and what's the difference you see from the time when you were diagnosed at that time until now, as a patient representative, as a patient champion? You normally promote this more. So tell us about your thoughts.
Yes, I think it just gives you much more information on the risk checker, whereas my awareness of osteoporosis was just raised by chance through reading that newspaper article. It didn't really go into any detail about what osteoporosis was or the different things you could do to help, to help towards if you have any risk factors. So for me, I think it's a much better tool. It's a much clearer tool. It's easy to use. It's really good that you get the personalised information there that Maddy's mentioned. But I think the main thing I would say would be if it comes out that you do have some risks, don't panic. Don't suddenly think that your bones are going to crumble, because I'm very fortunate. I haven't had any fractures. I'm very, very fortunate. I haven't had any fractures since my diagnosis. So please don't panic and think that that you're going to crumble away, because it doesn't mean you're not alone. Speak to a healthcare professional, or there is always the charity nurse helpline, which has been mentioned before. You could always speak to them if you're particularly worried about it.
Indeed. And on that note, I must say, wow, the time has passed so quickly. Sometimes it does when you're having good fun. And we are just about to go on a break. So when we come back from the break, we will discuss a bit more about osteoporosis, and we will find out a bit more about what resources are available through the Osteoporosis Society, and how can people access those resources. I definitely like to get some more information about your story, Janet, as in what kind of services and help you have, how those supported service help you in terms of the whole thing, and what's the plan for next 2025 for the bone health. This and many more after this very short break.
This program will continue after the break. Continue listening to Inspire FM. Inspire FM. Inspire 105.1 FM.
Hi, this is Medea Cohan, author of Hats of Faith at Inspire FM.
It burns when I pee. It's right around the corner.
My sinuses are painful.
It's closer than you think.
His itchy rash is spreading.
It's just down the road.
My sore throat is getting worse.
It's not too far away. Your pharmacist can do a lot, and now they can provide treatment or some prescription medicine, if needed, for 7 common conditions without you seeing a GP. Just think pharmacy first. Find out more at nhs.uk/thinkpharmacyfirst. Subject to age eligibility, including 1 to 17 years old for earache prescription medicine. Service available at majority of pharmacies.
Luton's most luxurious venue for Asian weddings is now bigger and better than ever before. With 2 venues to choose from, Venue Central can provide the ultimate setting for your wedding. 2 huge venues, 1 high standard, right in the centre of Luton. Visit us online today at venuecentral.co.uk or call us now on 01582 451 767. Venue Central, affordable luxury in a central location.
Did you see that guy on TV?
What, that no comment guy?
Yeah, he was sick. What was his name?
I think it was Atiq Malik.
Yeah, Atiq Malik of Liberty Law Solicitors. Atiq Malik heads up the criminal law team at Liberty Law Solicitors, specialising in everything from serious crime down to road traffic offences.
To find out more or for a free telephone consultation, call 01582 459955.
Liberty Law, there when you need us most.
Inspire FM is looking for committed, talented and knowledgeable individuals to join the Inspire Academy as tutors. We're looking for tutors who can teach maths, English, science and IT to join our pool of tutors and run face-to-face sessions on weekdays. To apply or for more information, email rashid@inspirefm.org or call us on 01582 481810.
अगर आपकी सोशल हाउसिंग की रिहाइश में कोई मसला हो तो छुटकारा पाने का तरीका जानें। अगर आपने अपने लैंडलॉर्ड से शिकायत की है और आप उसके जवाब से खुश नहीं हैं, तो आप हाउसिंग ओम्बड्समैन को शिकायत भेज सकते हैं। पिछले साल हाउसिंग ओम्बड्समैन ने लैंडलॉर्ड को रिहायशियों को 6 मिलियन पाउंड से ज्यादा मुआवजा अदा करने का हुक्म दिया था। एक महफूज घर का होना सबका हक है। अपने हुकूक जानें, मुलाहिजा करें gov.uk/social housing।
Since October 2023, Gaza faces unprecedented challenges. Muslim charity dedicated to Gaza for a decade steps up in trying times. Clean water, hot meals and vital medical aid. Your support can deliver hope. £50 for emergency food, £70 for 20 meals, £150 for clean water and £200 for essential medical aid. Unite at muslimcharity.org.uk/Gaza or call 03000 111 786.
Give thanks to Allah.
Assalamu alaikum. The Prophet, peace be upon him, said in Sahih al-Bukhari, there are 2 blessings which many people lose. They are health and free time. So make sure you tune into Inspire 105.1 FM, for your health is your wealth, with Mr. Shagufta, the health and well-being show which combines rich tradition of Islam with modern scientific knowledge.
Every Friday from 5 p.m.
From the studios of Inspire FM, the time is now 6:30.
Any health advice given, whether general, diet, physical or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum and welcome to another exciting and educating edition of the Health and Fitness Show. I'm your host Fahad Matin for this show, and I hope and pray that all of us are fit and healthy by the grace of Almighty Allah. Today we are talking about osteoporosis with our two guests, Maddy Gamble, who's joining us from the studio, and Janet Boyd, who's joining us via a telephone line from Osteoporosis Society. This program is broadcasting live today on 28th of November 2024. See, I can forget the dates as well. And the time just past 6:30 p.m. This show is broadcast for our lovely people in Luton and all the surrounding areas of Luton, like Dunstable, Harpenden, Bedford. Our positive airways reaching to all our listeners through our Inspire FM radio, Inspire FM app or website, and people can view us, our listeners can view us through our Facebook Live channel or YouTube Live links. So good evening and welcome back. And now welcome back to both my guests in the studio and who's joining us from the phone. Good evening, Maddy and Janet.
Good evening.
Thank you. Good evening.
So before we went on break, we were talking and we were taking your views in terms of the risk factor itself. Now, going back into the osteoporosis, I know it is one of the things which affects everybody, but it affects women more than men. So you being women, both of you, and Janet, you being the person who has gone through this, but you have a family history who, so how hard it is for it affects just women, or is it more to affecting women in terms of this?
Shall I answer? So osteoporosis, we know that it affects women and men, but it does disproportionately affect women because of a number of different factors to do with hormones, like the length that women live for against men. Best if you have a look on our website, there's a clear sort of list of definitions there set out by our clinicians about why it is that women are more likely to develop this than men. Me personally, I became interested in osteoporosis and the work of the Royal Osteoporosis Society because my mother, sadly, she's going through chemotherapy treatment at the Luton and Dunstable Hospital, and it was raised there by her oncologist that she needs to be thinking about her bone health because of the effect that some of the drugs were having on her bones. And so she goes there now to the clinic to have infusions. And before then, I didn't know much about osteoporosis. I didn't know about the different factors. And my mother also has other factors that can affect, like she has celiac disease. That's one of the questions that the risk checker asks. So that's generally why I became interested and passionate.
Exactly. And Janet, in terms of you, as you have a family history plus yourself going through this process, is it from the patient's perspective? Because I know it's not easy when you find out about something like that. Is it hard, or is it something which you think that you've been provided necessary support? And when you came to know about this, can somebody there to guide you, support you all the way through?
I think the hard thing about it is because unless you've actually suffered from a fracture, certainly from my perspective, you don't know you've got it because you feel fine. You don't feel unwell. You don't feel ill. So it's quite hard to get your head around that you've got this diagnosis when actually you don't feel any different from the minutes before you received the diagnosis. So that is quite difficult. And I think in terms of support, I would say that the Royal Osteoporosis Society has been my main support, really. I've phoned the nurse helpline a few times over the years since then with what some people might think, is a silly query, but actually no question's a silly question. You should never feel afraid to ask it. And the nurses are so good and so supportive. and give you so much of their time. You know, you don't feel rushed. They're so helpful. That's been my main support. And also looking on the ROS website, the charity website as well. I think in terms of medical support from medical professionals, I guess because I'm fortunate and I haven't fractured and I don't have osteoporosis really severely as well, I only really see my GP with regards to checkups, and I get a scan every 5 years. But that's just from my perspective. Different people are on different treatment pathways. Some people might get scans more frequently. It depends on your local health service, I guess, and what they provide. So, yeah, I would say rather than medical professionals, it's more the society and I think peer support. So the people that I've met through doing the volunteering that I do, we all support each other because we all have a joint understanding of it. Not everybody has the condition, but everybody has been affected by it in some way. So they may have relatives or friends, family. So, yeah, peer support is really, really important. It's that thing about, again, not feeling alone. And I think the society also has the social media as well. If that's the kind of thing, I know it's not for everybody, but there is a Facebook group, you know, Twitter as it was called, it's now called X. I mean, I can't believe it at my age, I actually do go on it, but I do. And, you know, I keep up to date with what's happening, I think, with regards to any new treatments, you know, campaigns that the charity is doing. So it's a mix, but I would say certainly more support from the charity, not quite so much from medical professionals, but I guess I don't really need it as much from them in my position at the moment.
Indeed. So in terms of resources, whenever it comes to resources, what other resources does Royal Osteoporosis Society offer, Maddy?
So as Janet mentioned, there's a wealth of information on the website. So that includes a lot of advice on diet, on supplements, on safe exercise for bone health. And there's even a series of videos, exercise videos there that people can follow. If you have been diagnosed and prescribed with any treatment, there's really detailed information on each of the drug treatments there and fact sheets. And we've been talking a lot as well about the specialist nurses, if it's okay. So to talk about that now. So the Royal Osteoporosis Society has a team of specialist nurses and we have a free hotline to them. So you can call 0808 800 0035 or you can email them on nurses@theros.org.uk. You can email anytime, but the helpline is open Monday to Friday between 9 a.m. and 12:30 p.m. And 1:30 p.m. and 5 p.m. And, you know, you can ring and actually speak to someone, actually speak to a nurse and get your questions answered. And I know that it's something that, I mean, Janet can probably say is a real lifeline for people if they've got questions and queries in this journey, actually being able to speak.
That's nice. Yeah, at least somebody on the other side of the person.
Exactly.
Because I can absolutely imagine, especially nowadays, the medical healthcare professionals which we have nowadays. It's not easy to get hold of your GP.
Yes.
Or nurses in regards of some of the conditions, and it's hard because as Janet was mentioning about technology, things are progressed so much in technology. People are youngsters especially prefer chats and WhatsApps and all those things, whereas still the older generations who may get affected this bit more than anybody else, they prefer to be a person can speak to them in person. So for them, it's much easier to contact. You said it's a number they can contact to speak to someone.
Yeah. So free phone number 0808 800 0035, Monday to Friday, 9 to 12:30 and 1:30 to 5. And you can speak to a specialist nurse. And it's free for anybody to call. So not just if you've been diagnosed with osteoporosis and you have questions, but maybe just, you know, you're hearing today or you read something, then you're worried, got some more questions about bone health, whether or not it's something you're thinking about. Perhaps if you do our risk checker and you don't come up as high risk and you're not thinking that you want to go and see your GP just yet, but perhaps you're lower risk and there's some factors there that you're worried about, you can ring and actually speak to somebody that can give you advice and help.
Definitely. Let me introduce our listeners as well. So, listeners, If you have any questions or queries regarding our topic today, which is osteoporosis, please give us a call on 01582 481822. I repeat, 01582 481822. Or you can send us your questions by text or WhatsApp on 07779 481822. I repeat, 07779 481822. So in terms of the access itself, and you said people can call them, you also mentioned that they can email them or access them through website?
Yes, so you can email nurses@theros.org.uk if you'd rather communicate via email rather than over the phone.
Mm-hmm. So, Janet, in terms of your in your case, and I remember you mentioned in the earlier part of the show regarding your journey through this time throughout this process. What is the best thing you like about in the whole process? And you said you feel supported, and that's kind of encouraged you to become one of the champions to provide necessary support to other people, and how other people feel when they feel necessary supports available for them as well. Janet? Hello?
Perhaps she's dropped off.
Yeah.
I could speak a little bit about some of the support that we have in the community while we're waiting for Janet to come back in. So she mentioned that the experience in being diagnosed with osteoporosis, it can be quite isolating, and the importance of peer support, which is why it was really important for us, and part of why we chose Luton is this understanding that there wasn't a support group there wasn't anything going on at a community level there. So one of the things that we've done in Luton is to establish a support group, and we met for the ROS support group in Luton, and we met for the first time last weekend. And it's a really welcoming and friendly group, a safe space to share experiences and just support one another, and above all thinking about living positively with osteoporosis, not just dwelling on the negatives, but how to and share advice about how to live positively with the condition. And our next meeting, for anybody who might be interested, is on Wednesday the 15th of January from 1:30 p.m. to 3 p.m. at Bushmead Community Centre.
Exactly. So Janet, can you hear us, Janet?
I can. Yes, I'm back on the line.
sorry about that. So I was asking about your personal experience in terms of osteoporosis. What is the best thing you like about and something you like to get something you can improve or provide necessary improvement support to other people?
I think it's just listening to people. I think from my point of view, when I went along to the Newcastle support group when I was first diagnosed, and the thing that I found, there was a consultant from the hospital speaking, and that was great, and it was really interesting. But I think the thing I found most useful was speaking to other people who also have the condition, because they are the people who really understand what you're going through. So I find that's what I end up doing, when, again, it's that peer support. So with other volunteers who are either affected by it because somebody they know has it, or they have it themselves. I think it's just that shared, that common understanding, really. So I think it's listening to people and also signposting them to the charity, really, and to all the help and the information that's on offer there, to try and get people to understand that you really are not alone. You must never think you're alone, and you mustn't panic when you get that diagnosis, because, as I said before, it is, and as you said, Fahad, it's quite frightening. It could be because you've been fractured, you fractured a bone, and then you get diagnosed, or it could be like me, you've just been sent for the deck. So whichever route you end up getting that diagnosis, it's not an easy process. So just remember, please don't panic, and speak to somebody, whether it's the nurse helpline at the charity, whether it's a medical professional, or whether it's somebody else, if you happen to know somebody who has a good awareness of the condition.
Yes, indeed, and I can absolutely relate to that, especially if you've gone through a fracture, or if you end up having a fracture. It's not that easy, because you're already going through a pain, and at that time,
right.
and if you don't find it necessary support available for you, being a human being, it gone into a very awkward spiral of events in your head and mind and body, and then automatically create more problems. And that's one of the and I really like the project itself, the Better Bone project for Luton, and I must say it's really rewarding. Is there something going on? Any local events happening? Is there any events happen this year, or how the local Luton responding to this project itself?
So we started first going out and visiting different events sort of from like the end of September, beginning of October, and the response has been really good. A lot of people sadly don't have a lot of knowledge about bone health, about osteoporosis. What is osteoporosis?
Exactly.
Has been the most common question. So what we really want to do is actually get out there, meet people, answer questions, and be able to share our different information and share the risk checker in particular with people. So we're next going to be tomorrow at the Hatters Primary Care Network Winter Coffee Morning.
Mm-hmm.
So that's at Chorlend Community Centre tomorrow from 10 a.m. to 12 p.m. We'll be there. And then next week we'll be at Birmingham Health Centre Coffee and Chat on Friday the 6th of December from 10 a.m. till 12 p.m. So we hope to see you there.
Mm-hmm. Indeed. In terms of, you mentioned about the project itself, Better Bone project. So, how people know about this, and what kind of an information they will get when they will be there? I know you mentioned it earlier in the beginning of the show, and in terms of the stats, if you don't mind sharing it again.
Some of the statistics for Luton.
Yep.
Yeah, so this was why the Royal Osteoporosis Society was really keen to run a project in Luton. So as I mentioned at the beginning of the show, there's no fracture liaison service at the Luton and Dunstable Hospital. We also know that in Luton, the diagnosis rates are lower than the national average.
Mm-hmm.
And then, as I mentioned earlier, up until we started this project, there was no support group, no peer support. And also in Luton, we know in some of the areas where there can be higher deprivation, such as the wards of Biscuit and Dallow and Farley, we know that people living in these wards are at a 25% higher risk of having a fracture from osteoporosis, and are more likely to have low bone density, and therefore are more likely to have a hip fracture, 25%. And we think that's unacceptable.
It is indeed, because I know, because I've seen some of the family members going through that process of hip fracturing, and it's not easy. It's not definitely not. And majority of the people out of those 25% end up permanently disabled throughout their life, and especially if your quality of the life do get affected if one is been having any fracture whatsoever, regardless of whether it's a hip fracture or a knee fracture or any bone fracture throughout the body. So in terms of the is there you mentioned about the support group, so is there a Royal Osteoporosis Society support group in Luton now?
Yes, so there is now. So we, as I mentioned earlier, we met for the first time last weekend just gone, and then we're going to meet again in January, Wednesday, January the 15th at 1:30 p.m. at Bushmead Community Centre. And really would just like to be able to offer people somewhere safe to come, speak to each other, support each other, and talk about how to live positively with the condition, as well as the work in terms of spreading awareness. So a little bit more about what's going on in Luton. We know that in the last 3 years, there's been 1,058 hip fractures in Luton. 1,058 hip fractures in Luton in the last 3 years. And again, we think that's unacceptable. The charity describes a hip fracture as being like a heart attack level healthcare emergency in terms of how it can affect people for years afterwards, how it affects everybody around them, long stays in hospital. We also know that 1 in 3 people over the age of 50 unfortunately die within 12 months of a hip fracture from complications around it. And just, yes, these numbers are too high in Luton, and we as a charity have got to do some work, put the legwork out there in the community, bring these numbers down.
I really fascinate with the numbers and myself. And do you have any think background breakdown for those ones, as in which community affected more in terms of the hip fracture now. If not, then hopefully when we do next show about this one, I definitely like to know a bit more about it. But I absolutely agree. It's not that easy, because especially if especially if it affects women more than men. Men, yes, they are sometimes chillaxer in their life, but women normally a female are the backbone of the house in majority of the Asian households, or in general households anyways, and maybe that's one of the reasons they survive more. Their ages are slightly more because they are always active. And if one have a hip fracture in that way, it's automatically made their life, the quality of their life is very, very fragile.
Well, definitely women, we work hard and it's very easy to put everybody else in the household before your own healthcare. But please take a moment, do the risk checker for yourself and begin those conversations if you do have some risk factors with your healthcare professionals, because these numbers are unacceptable in Luton.
Indeed.
And we want to bring them down, and this is a step in that direction.
Exactly, definitely. So what's the plan for 2025? I know the year of 2024 is about to end. We are almost end of November.
So
there's only 1 month remaining, and majority of that month will go in the holidays. So what's the plan for 2025?
So definitely watch this space. We hope to attend a lot more events in the community and continue to grow our peer support network. If you're interested, please go to the ROS website and visit the Royal Osteoporosis Society website, and visit the support in your area section. And you can sign up for our Eventbrite then to get notifications for our next meeting and find out details of where we're next going to be.
Indeed. And on that note, I must say, wow, the time has passed really quickly. We just have under 3 minutes before the show ends. So coming back, you mentioned about people getting involved in that section. So I definitely like to have a positive message from both of you. So let's start with you, Janet, because you, as a patient, gone through this process and a supporter for the community. How do you like people to involve in this one? And what's your positive message about this topic?
Well, I think my positive message would be always remember it's never too late to start helping to protect your bones. So whether you're 20 or whether you're in your 80s, I often get at community presentations where I often present to an older audience. I often get people asking me, well, is it too late? Can I do anything? And no, it's never too late. That's the main thing to remember. It's be positive, because the condition is treatable. So the first step is finding out your risk factors. And I would say that's the biggest thing I could say, the biggest piece of advice I could give, definitely.
Indeed. And I like your message. Be positive. And it's definitely never too late to ask for help and to provide that necessary support to others, regardless whether you have gone through the process by yourself or if you are one of the carers or one of the loved ones have gone through this process. And definitely. So Janet, as a patient, how are you looking after yourself? Do you drink more milk or take more vitamins? Or
I mean, obviously, it depends on the health conditions you may have. I also have a genetic high cholesterol condition, so I've got to be quite careful with the amount of cheese that I eat, much as I love it. But yes, I do make sure, and again, the charity has a lot of information on the website. I'll make sure that I'm getting enough calcium from the diet. There are also supplements available which you can take if you don't think you're getting it from your diet. Vitamin D supplements, I also take them throughout the winter, and it's exercise as well, really.
Definitely.
It's what you would call common sense, I guess. It's everything in moderation, isn't it? And
indeed.
Being fit and healthy, that's the main thing. Getting out there, getting on walks, trying to keep your bone density as strong as possible.
Indeed. Maddy, last 20 seconds.
Yeah, so it's Better Bones for Luton. This is very much a project for you. So we want to come out, we want to speak to you. If you're having any community events, particularly where we might speak to women aged 40 to 55, please invite us. Please point people towards our support group. And in particular, please take our risk checker, take that first step.
Indeed. And on that note, thank you so much for both Maddy and Janet to join our show.
Thanks for having us.
And sharing lovely information. And definitely we will see you guys again in next year. And that on that note, I must say thank you so much for all our listeners who joined us today, for listening to this show, and keep listening to Health and Fitness Show. We will be back again next week with Brother Leo, who will be guiding us about necessary health and well-being in winter days. So stay tuned. Keep listening to Health and Fitness Show. Until next week, I'm your host, Fahad Matin, signing off saying Assalamu Alaikum.